This tutorial helps to increase your patient's compliance with your treatment recommendations and decrease your malpractice lawsuits. In our first video, we quickly covered the 6 parts of the patient history, providing a foundation for medical analysis. But by taking a good patient history, you are also starting the process for a good outcome by actively showing that you care. Medical professionals often blame the patient when things go wrong. I asked and they didn't tell me, or they didn't follow the full course of antibiotics and now they're back. But it's your job to earn a patient's trust so they fully answer your questions, and it's your job to convince them to follow your prescriptions. And you're more likely to succeed at these parts of your job if you show that you care. Furthermore, it's one thing if the patient doesn't get the desired outcome but believes you tried. It's another thing if the patient doesn't get the outcome but believes you didn't even care. So how do you show that you care? When patients say that they want you to care, what they often mean is that they want to feel that you like them. So smile when you enter the room, and as you introduce yourself, actively show that you enjoy being with the patient. Smiling does not take additional time. After eliciting the chief complaint, stop smiling and reflect what the patient says. "Oh, your head hurts? That's too bad. Why don't you tell me what happened starting at the beginning?" And then listen. Do not interrupt to clarify details until the patient is done speaking. As the patient talks unprompted, they'll often clarify important details on their own, so you're actually saving time that would be wasted by speaking unnecessary sentences, while the patient learns you care enough to listen to their full input before you decide what to do. So, smile and introduce, stop smiling and reflect, listen and don't interrupt. This might seem obvious and easy, but it's not, especially with an increased patient load and stress level. As you watch your clinical instructors, observe how or if they show the patients that they care. They'll probably get the required data for their analysis, but does their body language show they care to the patient? Or are they detached in a Parkinsonian masked faces the entire time? So you probably can't expect most of your clinical instructors to teach you much about squishy but important lessons such as how to show you care. You'll have to develop your style of showing you care on your own, like when you're first practicing history taking with fake patients. And it will be up to you to actively show you care as part of your patient history taking routine. Your instructors won't grade you on it, but your patients will notice, and you'll have better patient compliance and fewer malpractice suits. Please comment below with your tips about how to show you care while taking patients' histories. HelpHippo, help support the Hippocratic Oath.